everybody, welcome back to Gastric Cancer Awareness Month with me, Raquel. So today we're going to talk about diagnosis and how we make a diagnosis. So say you have a bunch of symptoms and we're getting to the point where, we got to figure out what's going on. Well, the thing that we need to do is get a biopsy or look into your stomach to see what's going on. So how do we do that? We do an esophago-gastro-duodenoscopy. That is the supercalifragilisticexpialidocious of medicine, and that is way too long. So what we call that for short is EGD, or endoscopy. And what that does is you put a tube in your mouth, down into your throat. There's a little camera that can go into your stomach and look around and see, do we see any tumors? Do we see anything unusual? In my case, I had hundreds of polyps. Some people have tumors, and then diffuse gastric carcinoma or signet cell gastric cancer. You don't actually see anything, so they need to do biopsies. And so you biopsy the polyps, you biopsy tumors, or if CDH1 mutation, people will tell you, you get the biopsy to see the deeper layers. Once we get the tissue, we can look at it and see, is this cancer? And then we run a bunch of genetic testing on it to see what treatment there is. The advances of oncologic treatments over the last few years is pretty amazing. So we really need to run these genetics to see exactly what we can do to treat these cancers. The other things that we'll do is a CT scan of your chest, abdomen, and pelvis to see if you have any distant disease. Sometimes imaging comes first because if there's like an enlarged lymph node, sometimes they could do the biopsy of the enlarged lymph node, and then we can get a diagnosis from that. And then unfortunately that also tells us this is advanced stage disease that's metastatic and distant spread from the stomach. So that's kind of where we start at. Of course, there's PET scans if it's confirmed, and then some other testing depending on what kind of gastric cancer you have, all that kind of stuff. But that's where we start out. So stay tuned for tomorrow. I'm not sure what we're going to talk about tomorrow, but stay tuned. It's going to be awesome. Okay.